Good afternoon, everyone. My name is Menoze, and this is my CBT case presentation on our sessions that we had this semester. So just a little bit about really just some insight on like what I chose. So within my client sessions, I decided to have a diagnosis of social anxiety disorder for my client, which I'll give a little bit more insight in a little later in the presentation. But just for some type of literature review and just like some more insight on what social anxiety disorder is. So according to the New England Journal of Medicine, social anxiety is characterized by intense fear of social situations in which a person may be scrutinized by others. Essentially, the person might fear being judged or evaluated, and they may think they're either anxious, weak, stupid, boring, unlikable. They typically have a really bad cognitive distortion about themselves, and that kind of just leads into them feeling as if they're unsuperior or like feeling like they're more inadequate when being in social situations. This is one of the most prevalent disorders within a lifetime. So there's a prevalence of 13% within a 12-month period, and that's among 8% of adults. And then this also has similar prevalence within adolescents as well in the United States. Um, some of the consequences that come from social anxiety is that disorder has high socioeconomic costs. So, like more than 90% of persons with the disorder report psychosocial impairments, such as an increased risk of dropping out of school, reduced workplace productivity, reduced socioeconomic status and quality of life, and more than one third report severe impairments. I really appreciated the literature behind this because it shows that a lot of people experience social anxiety and a lot of people experience social anxiety disorder and how that can truly impact them as a people, and it impacts them in every certain way. So I really wanted to kind of target social anxiety disorder with CBT because CBT, as we know, it's it's the study of like how your thoughts impact your behaviors and impact your feelings, and that's something that I kind of wanted to explore how CBT can help social anxiety. And then just with treatment, social anxiety disorder can typically be treated with psychotherapy or pharmacotherapy or both. So CBT is one of the most highly regarded first line of treatment when it comes to social anxiety disorder. And a lot of times, social anxiety is often mistaken for shyness. So most of the time, it's like unrecognized and until it's like too late. And that's just another disservice to the people that we serve. So here's some of the case history of the client that I was able to serve. So the client that I had was Tyann Clarizer. She's a Haitian American 24-year-old female, born and raised in Miami, Florida, in a two-parent household with four siblings. When she first came into therapy, the main complaint that she had was to improve her family relationships because she described it as dysfunctional. But as we continue just to speak and just delve deeper into certain things, she noted that she also wanted to develop a new social support group in the new city that she moved to. She previously had expressed just anxiety in social scenarios due to her previous experiences. And that were negative, and she feels like she won't be liked and or accepted. So within that, we kind of noticed that there's a cognitive distortion that she was experiencing, and there's something that kind of led me to the treatment planning that I had that I'll talk about a little bit more later on, but the treatment planning that I decided to go with because of her chief complaint. But she did present symptoms of social anxiety disorder during our first session, but it took maybe like two more sessions to actually diagnose her with that. So she expressed a lot of cognitive distortions, such as mind reading. She kind of believes that she kind of reads the mind of others and like, oh, they're automatically just not going to like her due to how she sees herself. And then also her all or nothing thinking, as well as a lot of negative automatic thoughts when engaging in social situations. So we diagnosed her with social anxiety disorder. She had no past psychiatric history, no past medical history, and no substance abuse. So, for our case formulation, we had our precipitants, cross-sectional view, longitudinal view, and our strengths of the client. So for the precipitants, the client sought therapy to deal with her family issues and to grow in community as she just moved to Tampa. However, the client did note that she is heavily anxious and fears others won't like her. This cognitive distortion is what led majority of our sessions. And within their session, we talked a lot about, again, negative automatic thoughts, intermediate beliefs, core beliefs, and then also like finding evidence that can, I guess, support those beliefs. And typically, when we did those things, she found that there was not much evidence there. So that's kind of what kind of led us through our sessions. So the longitudinal view, excuse me, the client is experiencing heavy social anxiety due to previous experiences. She also experienced heavy dysfunction within her family. So the client continues to have the same cognitive distortion that no one likes her, and she also believes that she's unable to be fully liked or that she is inadequate. And this is super important just to note because it kind of gets to the deeper root of like the issues. So it's not necessarily like she doesn't know how to make friends. It's more of like she already didn't have a best relationship within her family, and she may have felt like she was overlooked, especially with such a big age gap within her siblings and her. So overlooked and not really being seen. And so then when she experienced that again within her previous friendships and relationships, it kind of reiterated that belief that she already had about herself. So now as she's continuing on and trying to like have these new experiences, she has this type of anxiety and fear that's kind of attached to that. And then for our cross-sectional view, the client tends to avoid seeking out social settings specifically because of this fear or a potential relationship in fear that she would not be accepted. The client also has a core belief that if she's not a core belief of not being enough due to dysfunctional family relationships, which also impacts her ability to connect with others without anxiety and fear. But some of these strengths of the client, I will say that the client, although this was her first time in therapy, she was very open and receptive to the tools and interventions of CBT, and she was willing and able to do the work outside of therapy to manage the anxiety symptoms, which is honestly all that you could ask for in a client. Every single time there was a homework due, she did the homework and she decided to come back with any questions or anything she may have had. So that was a really big strength of that client. So, our basis treatment plan that we kind of that me and the client worked together with within our one of our sessions. The main thing overarching was to reduce anxiety symptoms. Right after she was diagnosed with social anxiety disorder, she understood like the importance of reducing the anxiety, and understood that anxiety is what's leading her to like do a lot of the things that she doesn't necessarily want to do, hence the thoughts, behaviors, and feelings. Also, improving relationships with family members. That is one of the first things she said when she wanted to get here, when she wanted to start therapy. Developing social support, and then also identifying core beliefs. And the identifying core beliefs really came from my side of things, and I kind of explained it to her how like those core beliefs are what's leading, can be the thing that's leading her to this these cognitive distortions and just making it feel like she's not adequate enough or unable or not liked enough and stuff of that nature. So, there was many methods that we use within our sessions. A lot of it is like identifying negative thoughts, putting evidence behind it, intermediate beliefs, core beliefs, stuff of that nature. But something that I found that was very helpful, that I did with her was mindfulness. And this mindfulness was very important. And the mindfulness techniques that I kind of used was the 5 4 3 2 1 grounding technique. That was specifically used so when she is experiencing that anxiety right then and there, she has a way, an area to bring her back into the present moment. So then once she's back into that present moment, she can then use the tools and use the skills of like identifying a negative belief, without her feeling like she's all over the place and like just like not really in control. We also use the 4 7 8 breathing technique. This was to calm her down, and just bring her back into the presence. And then as well as meditation that I offered up to her. I let her know that she could start at 5 minutes and then she can move up to 60 minutes if she needs to. So these techniques link to the client's treatment goals of reducing anxiety because mindfulness is a great way to bring presence and calm down anxieties while in the moment and making her more equipped to identify the negative automatic thoughts and combat them. And then here is just some research that kind of backs up that mindfulness-based interventions tied with cognitive behavioral therapy has been very beneficial and effective. So in our first one, it says the effectiveness of MBI in reducing social anxiety disorder symptoms remain consistent between the follow-up and post-up, and it suggests that mindfulness is durable for anxiety disorder. And then also mindfulness is particularly useful when clients are engaged in a maladaptive thought process, such as obsessing, ruminating, worrying, or self-criticism, which is everything, not everything, but for sure, ruminating, worrying, and self-criticism is what this client experienced. It also helps her with negative emotions, thoughts, images, or anything of that nature. And it also just helps alleviate the social anxiety disorder symptoms. So here are the results that we had. So I had the client take the GAD-7 anxiety score test for session one, session three, and our last session, session five. And then according to the data, her anxiety score has decreased over time. So as you can see, in session one, she was at a 12, which is mild, which is moderate. And then during our third session and applying the skills that we learned during the sessions, she went to 3. She went to 10, which is still in the moderate level, went down 2 points, but still not really there. And then for our last session, she is at mild, which is at that 5 level. At that 6 level. So her anxiety did decrease over time. However, I do think this is a lot, like she still has to progress and put a lot more effort and time into it. Being that this was her first time in therapy, I know there's going to be just more time that she has to be in it before she's able to be completely terminated. And that's why within one of our last session, I decided to connect her with somebody else after somebody else that's more on the trauma informed side of things, because I'm noticing a lot of the things that she was experiencing when it comes to her social anxiety disorder came from trauma and those core beliefs. So having her explore those core beliefs was very instrumental to our journey together, and has helped lead to a decrease in anxiety. But we need to continue to just do more work in that area. So here are some of so for discussion here, the social work implications. CBT has been widely researched and has been demonstrated to be effective treatment for clients struggling with anxiety, fear, rumination, worry, and it helps people identify and change destructive or disturbing thought patterns that have a negative influence on their behavior and emotions. So in Tyan's case, mindfulness combined with CBT techniques proved to be beneficial. And in clinical practice, CBT should be used because it's an evidence-based practice and allows real change to happen within the lives of others. There's a reason why it's so widely researched, because it works. So I definitely think as clinicians, as social workers, that's something that we should try and provide to not our students, to our clients more and more during our sessions to be just to be beneficial for them and just to help them take control of their lives. Here are the references, and thank you so much. Have a wonderful day.